First of all, a big, massive clap to you all. Well done. I think, you've done so well to do these interviews and do them virtually. And as well as said, you've gone through the process all virtually. It's something to be commended because it's not an easy forum to do it on. But also to go through all the questions I've asked you, well done, because they're not easy questions. And there is a reasoning behind why we've decided on asking these questions. And for everything, your responses have been really interesting. And there's some really interesting perspectives on the challenges that you foresee in the future, and also how you feel technology is going to, in some cases, challenge the role of pharmacy, but also bring its own benefits to it in its place. So if I can just give kind of an outline on where we are. So I have chosen a winner, and the reason for that is, or who I've gone with, the choice. So going down through the questions, I feel that the profession going forward is very much going into a clinical side of it. So within community pharmacy, but also within hospital pharmacy. So basically, the patient is the focus going forward, and the technology support that pharmacy are going to encounter over the next number of years are going to bring benefits. So yes, it's going to be a changing and evolving system that's there, but and being training manager, I've delivered actually a training seminar on this in the past couple of years, but it's less a case of being worried about roles within pharmacy, and a robot may come in and replace you or replace the dispenser or etc. It's more about looking at how the role of pharmacy is evolving. So yes, you may have technology coming in, and that may mean, oh, I don't need to do that anymore, but actually it frees you up to be very much more focused on the patient. And with the way and the agendas that the NHS and Public Health England and globally, the agenda is that pharmacy is going to be a lot more focused on the clinical care being delivered to patients in the community. And some of you mentioned the chronic conditions which patients live with every day, but once they're managed within a certain capability, it means that they can live with them. They don't need to be with their GP. They can get that support and focus from pharmacy. I think there's some really interesting viewpoints on kind of where pharmacy can go. So, looking at independent prescribing has been mentioned, looking at the personalization of medicine. I think these are really great broad views to have for pharmacy going forward, because where people may think technology is taking over, this is where you're actually going to excel, is in these areas, because they're very patient focused, and you can't eliminate the human element of pharmacy. And I think no matter how developed technology gets, we always need to remember that that human touch is always required within healthcare, because it reassures customers and patients. They're unwell, a computer can tell them they're not well, but a human can tell them it's going to be okay. And I think as you go through in your careers, don't forget that, because from my own clinical profession, I specialized, it was in breast cancer, so I dealt with a lot of people who were having diagnoses, and a computer would confirm the diagnosis. You've got these aided devices, but the one thing that you can't ever replace is that human touch that reassures people that it's going to be okay at the end. So without further chatting from me, because I'm sure you're all dying to know who's won, Milan, congratulations, you're the winner.
Thank you.